My name is Ed and I am a goat farmer. The first 24 hours of a newborn's kid's life can really impact their overall performance and health throughout their lives. I'm here to talk to you today about the early management and rearing practices you can do to make sure your kids get a healthy start.
This video will focus on early management practices for healthy kids following a normal birth. You should develop a protocol with your herd veterinarian prior to kidding for what to do when problems arise. Once kidding is complete, ensure the airways are open and the kid is able to breathe. You can use a piece of clean straw to gently tickle the inside of the kid's nostril to make it sneeze, clearing any remaining mucus. If the kid is not breathing, it must be revived using protocols developed with your herd veterinarian prior to kidding season. Avoid mouth-to-nose resuscitation, as some diseases carried by goats can be transmitted to humans. In order to prevent chilling of newborn kids, especially during cold winter months, carefully dry the kid using a clean towel. You may also allow the doe to lick the kid dry. Because licking can transmit some diseases from the doe to the kid, this should only be done if the doe is low risk for diseases such as caprine arthritis encephalitis, or CAE.
Once I know that my newborn is breathing well and dry, I leave the kid with their dam for about 24 hours. This allows the kid to drink colostrum directly from their dam anytime they want and reduces the amount of labor required to care for newborn kids. I also tend to see better health in kids that were left with their dams for 24 hours. However, this can only be done if the herd is free of diseases such as Johne's and CAE. If a herd is not disease-free, kids should be separated from their dams at birth. Because this is a dairy goat farm, I separate the newborn kids from the doe and put it in a well-bedded, dry, draft-free pen after 24 hours.
Meat goat producers and dairy herds that leave their kids and dams together should make sure the doe is producing colostrum and the kid is suckling well. If nursing does not occur naturally, move the kid towards the udder to encourage it to nurse.
Some producers transfer newborn kids directly into a warming box after kidding to prevent hypothermia in cold temperatures. When removing the kid from the doe, it is important to remove it in a way that will prevent injury. If you are lifting kids, pick them up by their chest and abdomen, never by a leg or head. You can carry them in a horizontal position, but most producers find it easiest to use a plastic tote to move kids. Plastic totes are great because they can be easily sanitized between each use. Placing a straw in the bottom helps keep kids warm and comfortable.
If you choose to keep kids and dams together, you will need to make sure their housing is set up with the kids' needs in mind. If you separate kids and their dams, kids are usually moved to a group pen. Housing must provide all kids with a warm, draft-free environment. The ideal temperature for a kid pen is 10 to 18 degrees Celsius, so supplemental heating during the winter months may be required. There needs to be enough space for all kids to lay down at once, and plenty of clean, dry bedding to help maintain their body temperature. Kids that are wet are at greater risk for hypothermia. For more information on hypothermia in kids, see Ontario Goats Hypothermia and Hypoglycemia in Kids poster. Drafts can be deadly to kids, especially in cold winter months. Place straw bales around the outside of kid pens to block drafts. Remember that cold air settles near the ground, so you may be comfortable standing up, but the kids are being chilled. Make sure you kneel down and check the temperature at kid level. Kneeling in the pen is also a great way to smell for ammonia coming from the pack, which can bother the kid's respiratory tract. If your knees are wet when you get up, you need to add extra bedding to keep the kids dry.
Whether carried out when the kids are with their dam or after the kids have been removed, there are a number of recommended best management practices associated with newborn kids. These include colostrum collection and feeding, navel dipping, and identification. When feeding colostrum, it is important to remember these 4 things: cleanliness, quality, quantity, and quickness.
When the kid and doe are separated, colostrum should be collected from the doe as soon as possible after birth using standard clean milking practices, like wearing milking gloves and ensuring the teats are cleaned, sanitized, and dried in order to reduce the chance of bacterial contamination. All feeding utensils should be properly cleaned and sanitized after every use. As you can see here, colostrum should be slightly yellow in color, and it should look like and have the consistency of melted vanilla ice cream. Don't feed colostrum that is runny or thin, contains blood, or comes from a doe that has mastitis or that was treated with antibiotics. Once you know the colostrum is high quality and from a doe with low risk of disease, feed each kid 50 milliliters per kilogram body weight within the first hour of life if possible, and no later than 6 hours after birth. Each kid should be fed another 50 milliliters per kilogram of colostrum 4, 10, and 16 hours after birth. This is especially important for kids that did not consume the full dose of colostrum after birth. For a 3 kilogram kid, this is 150 milliliters per feeding for a total of 600 milliliters over 4 feedings. Establish a tube feeding protocol with your veterinarian to use in case a kid is not suckling well. Accidentally tubing fluid into the kid's lung could be deadly. If you are not comfortable with tube feeding, call your herd veterinarian for assistance. Tube feed kids the same amount of colostrum on the same schedule as you would a nursing kid. For more information on colostrum management, see Ontario Goat's Colostrum Management for Commercial Goat Production booklet.
Disinfecting navels is a routine practice on my farm and done as soon as possible after birth. I use a 2.5% iodine solution, but chlorhexidine also works.
Always make sure that the navel is clean and free of any debris before applying the solution, covering the navel cord all the way up to the belly. A non-return teat dip cup or disposable paper cup can be used. Discard the solution between kids. Disinfecting navels and keeping bedding clean and dry will help prevent navel infections. Check the kid's navel again in 24 hours. If the navel is swollen, hard, hot, or painful, it is likely infected. Consult your herd veterinarian to develop a protocol for treating navel infections.
In order to keep good records of birth dates, vaccinations, treatments, and withdrawal periods, I individually identify each kid as soon as possible after birth. I can also use their ID number to keep track of movements both on and off the farm. The kids should also be checked at least once daily for clean bedding, access to clean feed and water, and visually assessed for physical or behavioral health indicators, including hydration, drinking habits, manure consistency, ability to stand, temperature, and general disposition. This is how I care for kids in the first 24 hours of their life. By following these management practices in the first 24 hours of life, your kids can have success from the start.
Go to www.ontariogoat.ca to access more information on the management practices discussed in this video.